so recently a couple of people have asked me, like, how do you tell the difference between neural tightness and hamstring tightness? Now, if you've been stretching your hamstrings for years, months, whatever it is, or weeks, and you've seen no difference in your ability to extend your leg or touch your toes or things like that, chances are there's something beyond hamstring tightness going on. And we're going to go over a simple test that you can do at home to see, are we dealing with hamstring tightness or are we dealing with neural tightness? Because those two problems have two very different solutions, one involving nerve glides and the other involving probably some stretching, but also some strengthening work. So all you're going to need is a chair or a bed or even a really sturdy table to sit on, preferably something that lets your feet kind of dangle up in the air without touching the floor. If they do need to touch the floor, then do the best you can here if it's with a specific chair. But it has to be something where your knees aren't above your hips when you sit. So if you're sitting in that chair and you're like this, it's probably not going to work. But when I'm sitting here on my table, I want you to actually slouch. I want you to give me like the best slouch you possibly can. Now, how often do you hear physical therapists tell you that? Not very often, but this is one of those cases. But you're gonna slouch really good. You wanna round your back, you want your head to go down, and this is your starting position. So from here, I'm gonna have you pull your toes back, and kick your leg as straight as you possibly can. And you just go as high as you can. And then I want you to take an assessment. How does the back of your leg feel? Do you feel tightness? Do you feel numbness? Any tingling? Anything like that? And then you, while staying slouched, remaining slouched, you're just going to pick your head up. And then you're going to bring your head down. And you're looking to see if there's any difference between this position with your head up and this position with your head down. Now what happens is as you lift your leg and you're slouched and your head is down, you're putting a bunch of tension into the dura of your nervous system. The dura is the covering of your nervous system, all the way from your spinal cord down to the tip of your toe. And so if I put some stretch into that, if there's an infarct in the system, maybe a herniated disc, or maybe there's pressure from your piriformis muscle, if there's an issue in the nervous system, or with the nervous system, when you go to do this, you'll feel the tension. But then as I take some of the tension out from moving my neck, you might feel a difference in the symptoms. Okay, so maybe that takes some of the tension, the numbness, the tingling out of your leg. At the same time, you can go do that same test, so everything's really slouched. You lift your leg, toes are down here. You keep the tension in your neck, but you point your toe. And so that also can tell us, maybe lead us in the right direction of where is that tension. Is it more up in your back where the neck would affect things a little bit more, or is it more in the lower leg where the ankle would affect things? And then we can, once you figure that out, you can get a little bit more into specifics as to whether or not it's your peroneal or tibial side of your leg that is causing the issues. But what this can tell you is, hey, I'm having issues with the back of my leg. It feels tight, stiff, achy, numb, tingly, whatever it is. Is it my hamstring or is it my nerves? And now, this isn't the only thing you're going to want to do to figure those two out, but it is a really good start. And so what you might find is that if you do have that change in symptoms or change in sensation in the back of your leg when doing this test, you may be dealing with a nerve issue, not so much a muscle issue. And it's always good to just know what you're dealing with, because then you can deal with it appropriately. That was it. That's the seated dural stretch. Hopefully that can lead you in the right direction. And if you have any questions or need any help figuring things out, please reach out. You know where to find me, connectedpotentialpt@gmail.com, or just hit me up in my direct messages. All right, thanks.